Good morning, students. Last class see about fracture of the clavicle case discussion. This class I see about the amputation. As we will say about amputation. Amputation is a definition. This amputation is nothing but is the removal of the part of the limb. Is the amputation. Then your causes for the amputation is the mainly seen about the diabetic most severe of the diabetic patients infection, severe infection, the gangrenes are present, the gangrene. Then peripheral vascular disease. The peripheral vascular disease is mainly common at it's a struck of the blood supply or the entire most common in the lower limb, distal part of the lower limb. Then you will go prefer for the amputation. These kind of the causes for the mainly indicated for the amputation. Then you will go for amputation. Is the most common is for the industrial injuries most common. Industrial injuries most common. Then RTA or trauma injuries. Then infection, any infections. Then post-surgical infections. These are the most common causes for the amputation. Then you will go mainly occurs the infection seen about the PVD, peripheral vascular disease. Then gangrene. Then diabetic patient mainly seen about the foot ulcer. This is the most common cases. Then we will go for the amputation patient. First we will preoperatively seen about psychological counseling is important. Psychological counseling is most important. Then you will go for counseling for the family caregivers. Also support the psychological counseling. Then we'll go for preoperative management. Preoperative assessment is must taken. Then you will physiotherapy aspect. The preoperative management is there. First you will see about breathing exercise. Then range of motion exercise, isometric strengthening exercise. Then gait training is the also teached. These are preoperative training for the amputation patient. Then we'll go for the patient surgery. Then we will example like patients suffer from below knee amputation. That kind of patients mainly for the either one limbs are cut off the limb extremity. Then that kind of patients will choose for mainly in the stump care is the main important. Stump care is the main important. Stump care is nothing but is the ideal positioning of the stump. Stump is ideal positioning is the conical shape. The stump is the conical shape maintained. How should be maintained? Mainly for the swelling is the next class is about the principles of operative procedures. Principles of operative procedure. First point is the betadine solutions applied. Second is the cut of the skin. Then you will move to the blood vessels are the ligated. Then the muscles and fascias are ligated. Then that is a spare name. Then end of the bony prominence is the tendon junction is the cut of the extremity center limb, cut of the extremity. That's the principles of procedure followed by the amputation. Then we will go for the after suturing of the stem after the removal of the extremity. Then distal part will suture the C-shaped. Mainly C-shaped suturing is maintained. Then after that the suturing will first present on the drain tube is must needed. then you go for apply the dressings. First you will choose for rigid dressing. First you will choose for rigid dressing. Rigid dressing with drain tube. Then why should buy rigid dressing? The rigid dressing is the most compression of the extremity. Then is the avoid of the swellings. Then you will go for progression. You will go for semi-rigid dressing, or progression go for soft dressing. Okay. The most common thing is three types of dressing: rigid dressing, semi-rigid, and soft dressings. These are commonly used for the amputation patient. Okay, these are seen about the amputation. Next class seen about the post-operative rehabilitation of the amputation patient. Okay, thank you.